Health expert Dr Kgosi Letlape, who is the former president of the Health Professions Council of South Africa, is joining us now virtually via Zoom. Dr. Letlape, very good evening to you. Thanks for joining us. Welcome to the Globe.
Good evening, Simpu, and good evening to the viewers and listeners.
Indeed. Now, President Ramaphosa is calling a family meeting tomorrow, and this comes at the back of alarming infection rates. In fact, we've seen record daily increase rates in South Africa, which has been, unprecedented. So what is it likely to say? What is it likely to tell us? Are tighter restrictions on the cards?
I would expect tighter restrictions, but I think he would start at a localized level, where the tighter restrictions will be in relation to the hotspots. So, for example, an area like Gauteng will probably have areas that are defined as hotspots. We've seen what has happened in the Eastern Cape, and we'd expect KZN and the Western Cape to follow suit.
All right, and the issue of alcohol has been touted as one of the culprits for the spreading of coronavirus. Do you think it is, though?
I think crowding is how the virus spreads. The virus doesn't take any alcohol, but when people have taken alcohol, they lose all sense of proportion and they cannot control themselves. And part of the situation is that some of the outlets are acting irresponsibly in terms of not adhering to the numbers that need to be accommodated based on the size of the space. There's no physical distancing. The patrons are also quite difficult. But I think in relation to that, we need to take responsibility as individuals and as South Africans. So when you go to a place of joy where there will be no social distancing, you must understand that you are taking a deliberate decision to go to an area where infection can occur. So you are going to a high-risk area voluntarily.
And those high-risk areas could potentially be what you call the super spreader events. We've seen in the past few days about 948 matric learners contracting the coronavirus at the Matric Rage festival. How do we go about, Dr. Letlape, controlling such events and making sure that people attending those super spreader events do actually abide by the lockdown regulations?
I think we should have anticipated it, and events like that should have been cancelled as a precaution. And we need to remember, Simpu, that those that do not drink, and in families, we should not say because there's no alcohol, there wouldn't be a problem. The problem is overcrowding. The problem is close contact. Whether you are doing as a family of teetotalers, when there's too many of you in a closed environment, and one of you might be carrying the virus, there's a good chance of that being spread. So the super spreaders are not just going to come from places of leisure. Even when families gather for their rituals over the festivities, for any family activities, for weddings, for all those become potential super spreader events. So let's conform to the rules. Let us have a festive period that is compliant with COVID regulations. Let's give this festive season to COVID so that we can see many more festive seasons.
Well, Dr. Letlape, those in the know are suggesting that the indoor events are public enemy number one, perhaps, when it comes to spreading the coronavirus. But then, does this suggest perhaps that, the outdoor events should be allowed to operate or to continue because there is a less chance of spreading this disease?
I think from the regulations that have been published, it is recognized that indoor events are at a higher risk than outdoor events. But outdoor events are not innocuous. And that is why the number for outdoor events is double the maximum number for indoor events, 250 for indoor, 500 for outdoor. If I am outdoors and I'm standing next to you within the prescribed distance, less than 1.5 meters, and I engage with you in animated conversation for an hour, 2 hours, or we spend the afternoon together, the chance of transmission is just as high as in a closed environment. If you have prolonged contact that is more than 15 minutes, you are increasing your risk of exposure. Ventilation helps, outdoors help, but the key issue is even outdoors, keep your physical distance, keep moving around, don't be in contact with one person for a prolonged period of time, because that is going to be a problem.
And having said that, Dr. Letlape, most establishments here in South Africa, especially the entertainment establishments and the eateries perhaps, have imposed these no mask, no entry rule, which propels everybody entering that particular establishment to always wear a mask. Fair enough, people do abide by that rule, but once they get inside, they take off the masks, they don't practice social distancing. So, and having said that, Dr. Letlape, who is supposed to monitor whether people do abide by those rules? Is it the particular establishments themselves, or should it be external forces such as the law enforcement agencies here in South Africa?
It should be a collective responsibility of us as citizens. I would expect that in the establishment, they will have ensured that the seating arrangement are such that the different parties are at a safe distance from each other. It then becomes our responsibility as South Africans to be responsible. If we come as a family, we've been together, we've come in one car. If we're sitting at a table that is ours, we can take our masks off. But if you're now going to go to use the toilet, you're going to go into common areas, put your mask on as you do those activities. And when you come back to where it's people that you have been in contact with, you can then afford not to have a mask. But when you venture into spaces where you are now getting into the spaces of others, just take responsibility. This issue of wanting the state to police us and wanting law enforcement officers to come in is an unacceptable situation, because it creates difficulties. We don't want to have other incidents like we had in Alexander during our first wave.
Yes.
Let us take responsibility as South Africans. Let us remind each other. Let us not be aggressive and violent towards one another. So it comes from the establishment ensuring that they create an environment where it would be easy for the patrons to comply in the environment that they are in. You'll see that in most places, the workers are wearing masks. The people that run the establishment are wearing masks. They also need to be protected from patrons. It's not just about them protecting us from themselves. It's also about us respecting their rights to good health and respecting each other's rights. If we do not take responsibility as South Africans and take care of each other, there's very little that can be done in terms of law enforcement. What I hope the law enforcement officers will be doing is to ensure that the facilities comply. And it is the facilities that need to ensure that there's local supervision of ensuring that all of us comply as well as possible with the regulations that have been done.
Now, the issue of vaccines, I mean, the calls and the talks over vaccines are now getting louder. In fact, the United States says that they will start implementing the vaccinations from as early as tomorrow. In as much as it is still not certain yet at this point when the vaccines will be made available in South Africa, should they eventually reach our shores, should vaccinations be mandatory?
I think, there's issues of the rights of people. Vaccines, there won't be enough vaccines for everybody. And I suspect that those that want the vaccine will be far more than the vaccines available. So the issue of making it compulsory becomes a bit tricky. If you make it compulsory and you can't give everyone that now comes up, how do you enforce that? And one of the key issues that people need to understand is that even if we were able to secure vaccines for the frontline health workers and the vulnerable in South Africa or anywhere else where they have vaccine, like in the UK, the non-pharmaceutical measures will still be in place for a minimum of 6 months in conjunction with availability of vaccine. So it's not like if you get the vaccine, it's a magic bullet. No, you are adding something in fighting COVID-19. I can give you a simple example. And if you want to improve safety in a car, our cars have steering wheels, our cars have brakes. The brakes get improved all the time. Some of the cars have what we call an anti-lock braking system, ABS. Yes. When you introduce ABS, you are not taking out the brake disc. You're not taking out the basics that you have that are making the car safer. You are adding to make the car even safer. So we have all these things about fighting COVID, physical distancing, washing of hands, wearing of masks. We are now adding a component of a vaccine. It's not a substitution of the other mechanism. And people have to understand that the vaccine is not going to be available for everyone or being accessed by everyone. The current vaccine from Pfizer is very difficult to store. Hopefully, when we have the AstraZeneca vaccine, in which we've participated in the trials, it is a tenth the price of the other one, and it's much easier to handle. But even then, when we get that vaccine, let's understand this. The non-pharmaceutical measures need to be adhered to for at least the next 6 months or the first 6 months of having a vaccine.
Okay. Dr. Letlape, great chatting to you. Thank you so much for your time.
Thank you. And to people, please don't take the virus home to your vulnerable families or parents. You go out there, you pick up the virus. If you know where you have been, have the discipline of quarantining yourself, testing yourself, and isolating when necessary so that we can protect loved ones. It is not in the hands of the president.
Sure.
The state has given us the information. Let's utilize this to protect one another.
And most importantly, if you have it, please stay at home. Dr. Letlape, great chatting to you. Thank you so much for your time.